Worried about your drinking? Reserve your place on today's free Quit Drinking webinar and get a copy of my best-selling book, Alcohol Lied to Me, as a gift just for turning up. www.stopdrinkingexpert.com. Hey, how you doing? This is Craig Beck, aka the Stop Drinking Expert, coming to you from London, England. Sunny and bright. It's actually quite nice here at the moment. Today's video is going to be a game changer. It's going to be a fascinating one. And it's all about that big question. Have we now got the silver bullet? Have we now got the miracle cure for alcohol addiction? Wouldn't that be fantastic if it was true? Because it's what all problem drinkers have wanted. They've wanted to be able to just take a tablet and the problem goes away. Like a bacterial infection. You go and take the antibiotics, problem goes away. That's what we've always wanted. What we've ended up with is therapy, which in the most part just does not work. It's hard to do, it's difficult, you struggle, it requires willpower, just doesn't work. And that's why my approach to this has always been so different to the traditional 12 steps method. I mean, look, AA is the 12 steps, invented like 75 years ago. Basically says to you, you are an alcoholic, you are broken, you always will be. You have a problem so profound, so big that you're not powerful enough to fix it. So you got to take your problem and give it to God. That's basically the 12 steps. Now, if you want, you can go to rehab, but it'll cost you $50, $60, $70, $80,000, and all you'll get is the 12 steps plus some medication. So I don't know how it's happened, but here we are in 2024 with one pretty crappy solution to alcoholism. My approach has always been different. And if you've been watching me for a while or listening to my podcast, you'll know that I don't accept that broken label. I don't accept it for myself, and I don't give it to you. We are not broken because we got addicted to a highly addictive substance that you can buy in Walmart or Tesco or Asda or wherever you are from in the world. To suggest that people who get addicted to a highly addictive substance are broken is just insane, if you ask me. It's like saying that people who jump into swimming pools and get wet are losers. Yeah, how come you got wet because you jumped in the swimming pool? There must be something wrong with you. Doesn't make any sense at all. If you drink a highly addictive substance, guess what happens if you do it often enough? You get addicted. So you're not broken. You shouldn't have to carry this baggage around with you for the rest of your life. And you shouldn't have to go to a church hall and talk about the thing you're not allowed to use for the rest of your life as well. But wouldn't it be lovely if we didn't even have to talk about this? If there was just a tablet you could take and you go, oh, there we go, my alcohol problems have gone. Maybe, just maybe, that has happened. I'm going to play you a news report now about GIP agonists and GLP-1 agonists. You will have heard them under their brand names probably. You'll have heard about Ozempic. You'll have heard about Saxenda. You might have heard about Mounjaro. All of these are either GIP agonists or GLP-1 agonists, all right? They are designed predominantly to treat diabetes. That's how they came about, all right? But in the same way that, Viagra was created to treat heart conditions, and they discovered there was a much more impressive byproduct of it. What they're discovering with these GLP-1 agonists is there are various positive side benefits, and one of them is connected to alcohol. So let's play the news report, and then I'm going to dig into a bit more detail on whether this is a solution for you and whether you should take this route or whether you should go in a different route. All right, let's just watch this because it's quite fascinating. Let's fire it up.
On Ozempic and semaglutides is raising hope for those who drink excessively. It finds the weight loss drug may also help prevent alcohol overuse and abuse. This as researchers explore whether it has the potential to treat other addictive behaviors. Ariel Reshef has more.
I have no desire to drink wine anymore. And it's That's crazy to me because I couldn't stop before.
The wildly popular drug used for weight loss, semaglutide, is now showing very early signs of potentially curbing alcohol use for those who drink excessively. A new case study composed of 6 people screening positive for alcohol use disorder, or AUD, found that they all saw a clinically significant decrease in symptoms while they were using semaglutide for weight loss. Christy Martin, who was not part of the study, says while she used to drink wine every night, her urge to drink has disappeared.
Drinking for me was becoming a bit of an issue, and the fact that I just have no desire for it is something I didn't expect and is just an amazing side benefit. I can't even tell you.
This small case study now setting the stage for larger clinical trials, looking at semaglutide as a treatment for AUD, as researchers explore whether the drug has the potential to treat other excessive use conditions.
And again, this initial study only included 6 patients, but as you heard, more thorough studies are already underway. It could be years before we know the true results, but certainly reason to hope. Diane?
All right, we'll take it. Ariel Reshef, thank you. And ABC News medical contributor, physician at Stanford Children's Health, Dr. Alok Patel, joins me now for more on this. Dr. Patel, break this down. What does this research really tell us about what Ozempic and what other similar drugs could possibly do for curbing drug and alcohol use?
And what this research is really adding to is this growing body of anecdotal evidence and case series reports. This is patients basically filling out questionnaires or reporting that it's possible that semaglutides and these GLP-1 agonists, this whole class of medications we've been talking about, may decrease the risk of not only alcohol use disorder, but also in other addictive behaviors as well, with some specialists citing that their patients have reported decreased incidences of shopping and gambling addiction, even smoking, even in some cases nicotine or opiate use. So this is promising, but we definitely need more research. But again, we want to see all these data come out there so we can actually have those educational academic talks about more potential uses of these medications.
It's interesting that the anecdotal responses, they're not just drugs and alcohol. People say that they feel like they're less compelled to shop, less compelled to drink coffee. How significant is that?
You know, it's really fascinating, and it potentially is significant when scientists and physicians are looking at these hormones, these medications that are acting, these GLP-1 agonists. We've been talking a lot, Diane, about how they act in your gut. Now comes the conversation about what it may be doing in our brains when it comes to addictive behavior. And one theory is that it may actually decrease the satisfaction, that dopamine response that people get, whether they're drinking an IPA or they're going online to shop or gamble. So it is fascinating. And it's kind of just letting us realize that as we use medications, there's more and more side effects or reactions that may happen in the same way that these medications were first created to fight diabetes. And then all of a sudden, researchers are like, whoa, people are getting weight loss. What's going to happen next? So it's important that as we see these proposed benefits, we're also paying attention to the unknowns and potential side effects.
It's still early days for all of this, too. So what other treatment options are available for substance abuse disorders?
Well, the most important thing that people can do if they have a concern about substance use disorder is talking to a trusted friend, colleague, anyone it may be, to push you to go talk to a healthcare professional. And there are proven treatments, regardless of what substance you're on, whether that is medication, counseling, cognitive behavioral therapy. The first and most important thing that people can do is go and seek help. And it's important to not just look at headlines or anecdotal evidence. You know, one of these studies actually looked at social media posts. That is the hallmark of anecdote, people self-reporting, but that if you're suffering from substance use disorder, you don't just look at these reports and think that works for you. Individualized treatment is best.
There is a lot out there on these
Okay,
drugs.
let's leave that there. Thank you to ABC News for that, Dr. Patel. Not really sure why they had a doctor that specializes in childhood medicine as the speaker, and you know the survey of 6 people is not that impressive. And if that's all I knew, then I would probably urge caution. However, one thing that Dr. Patel said there was anecdotal evidence that this is working. And I've got to agree with that because, you know, I speak to a lot of people with alcohol problems, as you would imagine. And I do hear people telling me that, Craig, I started on Ozempic to lose weight and I found I didn't want to drink anymore. I am hearing that as an anecdotal side effect of these GLP agonists. So does that mean that we now have a miracle cure for alcohol addiction? And the short answer is no, but it's a qualified no. All right. In the same way that these new drugs, you know, the Saxendas, the Wegovy, the Ozempic, the Mounjaros, all these new drugs help you lose weight, but they are not a permanent fix to obesity. If you stop taking the drug, you put all the weight back on. And the same is true if you're using these drugs for alcohol addiction. What it basically means is there is a good chance, from what we're hearing, that these drugs help you deal with cravings for alcohol. They reduce your cravings, they reduce the dopamine response to drinking it. And we're hearing a lot of people saying that when they're on these drugs, they want to drink less. Fantastic. So is that the solution? Well, it's the same as the weight loss answer, in that the problem is when you stop taking the drug, your cravings to drink return at full strength. You will go straight back in to the loop of alcohol addiction that you were in prior to taking the drug. So what this means is you either address the reason why you're drinking and deal with that, or you stay on the drug for the rest of your life. Now, there are some people that will take that latter option because it's the easy option to a certain extent. Just stay on the drug. Then I don't have to deal with all the uncomfortable stuff. Just keep taking the medicine, right? The problem with that is it is cost prohibitive. These drugs are going to cost you around $13,000 to $14,000 a year to be on. All right. So if you are in the good position, the great financial position to say, that's okay, I can afford that, I can afford $14,000 a year for medication, then maybe it's something you should consider. Although that kind of rubs me up the wrong way, because my belief about medicine has always been that pharmaceutical medicine is a life raft, not a boat. You don't want to live on a life raft. The life raft is really important when there's an emergency. You throw out the life raft when you're sinking and you need help, and you get on the life raft and it saves your life. But you don't want to spend the rest of your life on the life raft, right? So it kind of goes against my beliefs to consider staying on pharmaceutical medication for the rest of your life. But that's kind of what they're suggesting. So here we have a bit of a problem. We have some new drugs, these GIPs and GLP-1 agonists, that appear to reduce cravings, but only while you're taking the medicine. What can we do to improve that? Well, look, if this is a route you want to go down, and I'm not a doctor, I'm not here to give you medical advice, but here's what I would suggest you do. If you're taking these drugs and you think they're working, you no longer have a craving to drink alcohol, during the period that you're on these drugs, I would work on the underlying cause for your alcohol addiction. If you can try and fix it while the cravings are not there to bother you, when you do eventually come off this drug, life should be a lot easier for you. Now, whether you believe it or whether you know about it, there is a reason underneath your drinking why you're turning to alcohol, all right? Maybe you're conscious of it. Maybe you know that you have past trauma that you've not dealt with, and rather than deal with that, you've just used an anesthetic to make it go away. Maybe you're not aware of it. You just find yourself in this loop of problem drinking and you don't know why. During the period that you're on this medication, I would urge you and encourage you to do some work on this, to find out why you were using alcohol in the first place. Because in, nearly 15 years I've been doing this, I've never met anyone who just drinks alcohol because they like it. There's always a reason underneath. And alcohol I've always seen as a symptom, not a problem. And this is another reason why I don't really like AA and the 12 steps, because it assumes that the alcohol is the problem. It's not. The alcohol use, the loop of problem drinking, is a symptom of a bigger problem that you're trying to cover up. And that can be anything from depression, anxiety, mental health problems, relationship problems, career problems, trauma from childhood. The list goes on, but there's always something underneath it. And then you've got the incorrect programming. the erroneous programming that you've put into your subconscious mind that alcohol is a solution to problems. And once your subconscious mind believes it has a solution to a problem, that's it. Doesn't question it, doesn't try and be creative and come up with different ways. It runs the program. For example, when you're crossing a busy road, do you try and do it differently every time? Do you try and use a different leg first each time? Do you wave your arms in the air? Do you jump up and down sometimes? No. You run the crossing the road program that you have established is a solution to the problem. You do it the same every time because there's no need to change something that works, right? Now, you've incorrectly programmed your brain to believe that alcohol is the solution to a specific problem. Your subconscious mind will never change that program unless you teach it how. And that's what my course does, all right? So I just wanted to share this with you because I think it's exciting. I think it's got potential, and I think it's going to change lives. And obviously, lots more research needs to be done. But if you're trying this route, what I would encourage you to do is also work on the underlying story. All right. So make sure you go to the website, stopdrinkingexpert.com, and sign up for the free webinar. And I'll talk you through how we drill down and find out the true reasons why you have become trapped in a loop of problem drinking. Hope that helps. If you have any questions or you want me to make a video or a podcast on something specific, drop me an email via the website, stopdrinkingexpert.com. Thank you so much. See you in the next one. Worried about your drinking? Reserve your place on today's free Quit Drinking webinar and get a copy of my best-selling book, Alcohol Lied to Me, as a gift just for turning up. www.stopdrinkingexpert.com.